Hello and welcome to our Health and Science Focus. I'm Yuveka Rangappa. Now, sleep is something many of us take for granted or think we can do without. Remember that saying, sleep when you're dead? Well, there's no such thing. A lack of sleep can be detrimental to your health and safety, regardless of how young or old you are. There is so much that happens in our bodies that is dependent on sleep. And if we're not sleeping properly, we could be causing some serious damage to ourselves. Just being a bad sleeper is one thing, but there are those who suffer from debilitating sleep disorders such as insomnia, sleep apnea, restless leg syndrome and narcolepsy, to name just a few. Well, in our Health and Science Focus this morning, we're looking at why sleep is important and at the various sleep disorders. I caught up with sleep expert Dr Alison Bentley earlier this week for some advice. Dr Bentley, let's start with why. Why is sleep so important to us as human beings?
Well, it's interesting because, there's a lot of talk about you can miss sleep, you can cut off sleep, you don't need as much sleep, sleep when you're dead, that kind of thing. But still, every single organism on the planet has to have this period of sleep. And so we know that it's about rest, it's about restoration, and it really does that 7 or 8 hours, however long you sleep at night, that absolutely is essential for the other 16 hours that we value so much. So if you don't get that 6 hours or 7 hours, then the next 16 or 17 hours is not as fruitful, it's not as productive. But more than that, what we know now is that pretty much if you restrict sleep for any reason, so whether it's shift working or voluntarily not sleeping, or you have any sleep disorder that interferes your sleep, we know now that there are long-term health consequences, and this includes heart disease, gastrointestinal disease, more likelihood of depression and anxiety. So there's really good, clearly what our sleep does is kind of give our entire body rest. So think about the heart. If the heart is not resting at night, it's going to run out of steam. I mean, it cannot keep going for 60 or 70 years without any rest periods in between. Well, so those are the main reasons.
Well, I want to go more into detail about what damage we actually do to our minds and bodies when we don't sleep. But let's just firstly just touch on what is actually happening to our bodies and our minds while we sleep. I know, as a mum, when you have babies, the nurses tell you, yes, babies grow while they sleep, their brains grow and develop. So as we get older as well, what's happening in our minds and bodies while we sleep? What is sleep allowing us to do?
So there are these two components. There's physical restoration, that basically the body does have a period of rest, but it also has a period of growth. So as adults, there's a hormone called growth hormone. As adults, pretty much all the growth hormone we make the entire day happens in the first hour of sleep. Not 9 to 10 at night, but the first hour of sleep. It's linked to sleep. And of course, as adults, we don't necessarily grow, but what we do is repair. And so with that growth hormone, and then there's a flow down of all kinds of different chemicals where we repair the body. And sometimes it's it's not that we've injured ourselves, but the fact is we have run for 16 hours. And so we need repair and we need restoration and we need the rubbish to be sorted out. And so that kind of thing. So it's almost like a spring clean that happens every night. So that's the physical restoration. And it occurs in usually the first half of the night, slow wave sleep, that part of the night. But then there's a brain restoration as well, and there's a brain flushing out. We know that the brain, just like any other organ, creates waste materials. Difficult for it to get out. I mean, the brain has it's a tight system, so that it's difficult for it to get out. But we know that during REM sleep particularly, that there's a flushing of the brain to get out all of the toxic chemicals. Now, that has consequences. If you don't do that, that has consequences because you start storing that, and they're toxic and they're not good. And, that's where this link between poor sleep and Alzheimer's has come in. Like, if you don't get rid of these proteins that you're kind of making, do they collect and do they turn into Alzheimer's eventually? We don't have the full answer to that, but there are some suggestions that might be the kind of importance of this type of sleep, And then there's dreams. What do dreams mean? Are they important to us? We know that during REM sleep as well, our brain looks like it's awake. And if you look at the EEG, it looks like it's awake, but you're clearly asleep. So something's going on, in there that it's obviously very important for us for the rest of our lives, really.
Okay, so Alzheimer's you've touched on, and you mentioned some others as well a couple of minutes ago, Doc. But let's just go into a bit more detail about what are some of the debilitating things that can happen, especially if we're talking physiologically and I suppose mentally as well, if you're not getting the right amount of sleep for you.
Not everybody's able to get 8 hours. I'm somebody, I can't sleep for 8 hours. I feel I've overslept and wasted a lot of time. But
Yes.
the right amount of sleep for you, what is happening? Things like weight gain and all of that.
It's actually really difficult to find something that's not affected by insufficient sleep at the moment, because there's so much literature coming out about it. But so, for example, the first thing that happens, so long before you get any of these long-term consequences, the first thing that happens is you have a drop-off in what we call executive functions. So that is your focus, your concentration, your memory, your ability to think laterally. And I mean, look, that is important no matter where you are and who you are, but particularly if you're a student, particularly if you're a kid at school, particularly if you're a lawyer and you're standing up in court, like, you need to be nimble. You need to be nimble in your head, and you need to be able to think through things. And if you haven't slept well, that's what you're going to lose first, long before you start actually getting sleepy during the day. So there are these kind of immediate effects that occur if you haven't had enough sleep. Sleepiness is going to happen mainly after lunch, during that little dip after lunch. That's where you're going to feel most sleepy. But then you move into kind of immediate medical effects. And these include things like, if you haven't slept well, you are more likely to catch cold, you're more likely to catch flu, you're more likely to catch pneumonia. In this era of COVID, we're kind of going, if you haven't slept well, does this mean that if you get COVID, you're more likely to get a worse dose, a worse kind of response to that? We don't know, but because there is literature to show that you are more compromised, immunocompromised, if you haven't slept well. So pain as well. If you haven't slept well, you're going to feel more pain the next day. So there's these immediate things, and then there are these long-term effects, which we've shown in people like shift workers who don't sleep well. So right from people who don't have a chance to sleep properly, through to patients who have insomnia, patients who have restless legs, patients who have sleep apnea, that whole group are more likely to have cardiovascular disease. Now, we worry about COVID and all these things. Cardiovascular disease is still the #1 killer in the world. And so when you're sitting with a situation that if you have obstructive sleep apnea, which is related to snoring, your risk of having a cardiovascular disease, if you have moderate sleep apnea, your risk goes up by kind of 3 times of having a cardiovascular event. I mean, that's huge. That's a massive impact of sleep on your health.
And Doc, let's take this opportunity now. You've mentioned some of them, the common sleep disorders that you're seeing now.
So, I mean, they really are divided into 3 types. I mean, the first one are the insomnias, which is that you get too little sleep. The second one is hypersomnias, where there's an excessive sleepiness during the day. And the third one are parasomnias. Now, parasomnias are sleepwalking, sleep talking, sleep eating, kind of weird things that happen during the night.
Yeah.
They generally don't cause problems apart from those events. So, sleep, whatever those events are. So it's really the too little sleep and the too much sleep, or what looks like too much sleep, that we really focus on. So insomnia, if we look at insomnia, the prevalence of insomnia in most countries around the world is about 10% for chronic insomnia in the population, but can go up to 30% if we look at acute insomnia that's just triggered by stress. So, for example, writing exams, trying to finish an MBA, those kinds of acute stresses that are just there for a couple of days or weeks, cause insomnia, and then when the stress goes away, we sleep properly. So, about 30% of the population, and obviously that's got a lot worse during COVID because of the stress and the anxiety around COVID, about financial anxiety, health anxiety, all of that kind of stuff. So that's got a lot worse. And so insomnia can be caused, there's like hundreds of causes of insomnia that you could go through. There's many, many causes, but they all come down to this common point, is that in the morning when you wake up, you're very aware that you haven't had enough sleep. And that continues during the day. And for chronic insomnia, that can go on for decades. So it's, and the insomnia moves from being being caused by something else into being its own disorder, its own little problem, and has to be treated very specifically. If you look at the hypersomnias, I mean, the one everyone knows is narcolepsy. It's the most rare of the sleep disorders. It's like less than 1% of the population. Obstructive sleep apnea, by far the most common of these type of disorders. And we don't have good data for South Africa to tell us what the prevalence is. There was a paper in the Lancet that modeled all the countries of the world and looked at what they predicted their prevalence to be. And they predicted our prevalence to be 23% for moderate to severe sleep apnea. That's a huge number. It is based on level of obesity, the number of males, the age, because all of those are factors, prevalence of hypertension, prevalence of diabetes, because those are all caused by sleep apnea. So those kind of things. And then another of the hypersomnias is leg movements, which is related to restless leg syndrome. So the restless leg syndrome can cause insomnia, cause difficulty in falling asleep. And once you're asleep, you can have these little leg twitches that go through the night, reducing the quality of your sleep and thus making you sleepy during the day. Wow. That's the quick route around sleep disorders.
So when I do kick my husband in my sleep by mistake, I can blame it on restless leg syndrome. Yes?
Well, yes, maybe, but don't ask me to write a letter about that, okay?
I won't ask you to write a letter. All right, Doc. So are there treatments for all of these sleep disorders that you've mentioned?
Well, I would say yes. I mean, I think that in the vast majority of cases, we are able to treat sleep disorders. Obviously, it depends on the sleep disorder. But I mean, so insomnia, the main way to treat insomnia is not through medication. It's actually through something called cognitive behavioral therapy, where we change the behaviors around sleep, push the biology of sleep to make it likely more happen, and change the thinking around sleep. But even if that doesn't work, then medications will work. So, you know, it's often a trade-off between how bad are the complications of not sleeping and how bad are the complications of taking sleeping tablets. And sometimes it's better to take sleeping tablets than to have no sleep for days and days and days on end. And there are situations in medical disorders, for example. So if you have severe pain, like rheumatoid arthritis, if you cannot manage that pain, best to let people sleep, because if you sleep properly on a sleeping tablet, you have less pain during the day. So that kind of helps. When it comes to sleep apnea, snoring, yep, it's about losing weight. It's about looking at the ENT problem if there's a blockage in the nose. It's about using an oral device. If none of that works, kind of like if you can't fix the cause of it, we kind of go to CPAP, which is a machine that that holds your throat open at night so that you can breathe properly and sleep properly. Restless leg syndrome has a couple of medications that can be used for it. Narcolepsy, we know what the cause is, but we can't treat the cause. And so we generally use stimulants during the day to keep people awake. So, you know, I would say that in 99% of the cases, yeah, it can be solved. There are very few cases where we just can't beat it, and there's a problem.
All right, so are we saying then most of them can be cured, or most of them have ongoing treatments that allow you to have that sleep? There is no cure. You're going to need something, but there is something to help you sleep at night.
Yeah, so I wouldn't say there is no cure. So in some circumstances, there is a cure. So we can cure insomnia, and we can get people sleeping properly. We can cure sleep apnea if people are prepared to lose 30 kilograms. Often the sleep apnea goes away. So we can cure it. So there are kind of points at which we can say, right, it's cured. But you're right. In most cases, it's about a treatment that's ongoing. Yeah.
All right. So is a sleep disorder something that is developed through time? Nobody's just born with a sleep disorder. I mean, for me, example, I've worked shifts for most of my career, either getting up at 2:30 in the morning, getting up at 3:30 in the morning, you know, and then we kind of go, oh, yeah, okay, I'll sleep on the weekend, you know, that kind of thing. So, you know, am I a candidate? Am I a candidate for a sleep disorder? Because I can't sleep in on a weekend already. So would you say I'm somebody who has a sleep disorder?
Well, I do know that when I get patients and they tell me that they have a history of hospitality industry, or they have a history in recording industry or entertainment industry or anything like that, I know where we're heading. And we're heading into a zone where your circadian rhythms have been messed around so much that they're kind of almost like they're throwing up their hands and going, nah, I don't know where we are anymore. Okay, that kind of thing. So that kind of thing does kind of creep up on you. Whereas some insomnia is very sudden. I mean, you know, you will suddenly have a stressful event, a death in the family, for example, suddenly acute emotional distress, can't sleep, and then that carries on for decades after that. So I can't tell you that there's a one size fits all, that they all kind of develop slowly or they all develop quickly. It's kind of restless legs often can just develop, boom, out of nowhere, just suddenly develop. Same thing with narcolepsy. You suddenly get the symptoms of narcolepsy. Obstructive sleep apnea is one of those that doesn't start suddenly. If you have sleep apnea, you've been snoring for 5 years, which is kind of so snoring is like a partial obstruction to the airflow, whereas apnea is a complete obstruction. So usually you've been snoring for 3 years. And when we put people on CPAP as well, they will tell us, you know, I actually think I've had this a lot longer than I thought, because I haven't felt like this for like 5 years. So I thought I only had it for a year or two, but actually I've had it for a lot longer. So there is that. And the problem is that when you wake up in the morning and you don't feel great, it kind of normalizes, like that becomes your normal. And then it creeps a little bit more, and then that becomes normal, and it creeps a little bit more, and that becomes normal. And so, and until you know it, the way that you normally feel in the morning is not normal at all.
Okay. And just back to that point is, the thing called sleep debt. It's a term we throw around so loosely, Doctor. Is there such a thing as sleep debt, or where I say, okay, I haven't slept Monday to Friday, but on Saturday, I'm going to make up for it? Can you actually make up for the sleep you haven't had for the entire week, say in one day? Or Is that
Sure.
realistic?
Yeah, no, there definitely is a thing called sleep debt. There's no question that if you need 6 hours and you only get 5, you're 1 hour in debt. And it's a bit like a credit card. It doesn't go away unless you sleep. Right? So credit card debt doesn't go away because you wish it away. You've got to sleep this one away. And so if you are in a situation like yourself where there is a debt being developed over the week, then yes, you do need to catch up. There's a dispute really on whether you need to catch up hour for hour, or whether when you catch up, your sleep is more efficient while you are catching up, and so you don't need hour for hour. But you should certainly kind of plan to get close to catching up the total number of hours. And it can really stack up. I mean, if you're short of 3 hours a night for 5 hours a day, that's 15 hours. Good luck finding 15 hours on your weekend to sleep.
Yeah, unless you live alone, have no children, and only the cats to feed, I suppose, at that point. Well, Doc, let's talk about how we can, before we get to this point, or if we feel, we're kind of at that tipping point where we might be developing some kind of a sleep problem. How do we train ourselves? What are the right things to do to train yourself when you get into bed so that you will get the best possible sleep in that time?
Well, the first thing to do is to actually figure out how your sleep works. There are clear biological factors in sleep that often people don't think about. So, for example, how much sleep do you need? Because we get told 7 to 8 that's the normal. It's not the normal, it's the average, and that's a totally different number. So there are people who can only get 5 hours of sleep, no matter how much they try. They can get 5 hours. Yeah. But the key thing is you have to be able to function well during the day. So if you function well on 5 hours of sleep, then you need to know, I need 5 hours of sleep. Okay. Then you need to figure out, am I a lark or an owl? Both of these things are genetic, so you can't fix them. Am I a lark or am I an owl? Larks are people who go to bed at 9, happy to get up at 4. I'm not one of them. I'm an owl. I will stay up till midnight. Don't wake me before 7. Okay, that's my deal. So you need to figure that out, because some of my saddest patients are patients who are very clearly owls, i.e. can only get to sleep at 11, 12, but want to be cyclists as well and get up at 4:30 in the morning. Okay, and I cannot make them happy and cheerful at 4:30 in the morning, because biologically that's not where they sit. So you need to know both of those things. And then you need, if, for example, you're an owl and you need 5 hours, pick your 5 hours. Going to bed at 9 o'clock, complete waste of time. It's not going to happen. So go to bed at 11, but understand if you need 5 hours, that means you get up at 4. Okay, that's how sleep works. Then you pick your hours and you stick to those hours. And what's most important, what I find that so many people who come to see me or just talk to me about sleep, I will say to them, what time do you go to bed? And they go, 10 o'clock. I go, are you sleepy when you go to bed? And they go, no, not really. They go, well, why'd you go to bed? Okay. So the sense that there is this prescriptive bedtime that you need to go to sleep at, even if you're not sleepy. Now, I can tell you something. If you're not sleepy, you ain't going to fall asleep. That's not happening. So you need to kind of stay up a bit later and drive that sleepiness, that biological sleepiness, so that when you are trying to fall asleep, you literally are at a point where you can't read because the book is falling, that kind of thing. So that's what we say to people. If you're having difficulty sleeping, go to bed an hour later. Okay. Make sure that you have a bit of a downtime. You need half an hour downtime before you fall asleep. Like just downtime so that you can read, so that the brain can kind of like change from this to sleep, and just let yourself gradually fall asleep. I mean, the normal time to fall asleep is not 30 seconds, it's 10 to 15 minutes.
All right, so fantastic. So just some simple things that we can do, things we actually know, but I think we've fallen into bad habits. Dr. Bentley, thank you so much. So informative. Just a very quick one. Where can our viewers go? If somebody needs help, they need to contact a specialist like yourself, just direct us, please.
So what I'll do is I'll give you my email address, because that's the practice address, because that's the easiest route to go. And that's just Bentley Practice, so Bentley, practice, PRACTICE, @gmail.com.
Okay, all right, at gmail.com. Great.
Okay, and I work at Morningside and Emmarentia.
Fantastic. Thanks so much for your time, Dr. Bentley. Great.
Pleasure.